While depression's impact can be measured in dollars, its greatest cost is in lives. More than 30,000 Americans, many of whom are lost in the fog of depression, commit suicide every year.
I actually had crushed up some glass and put it in an ice tray. And my plan was to freeze the ice and swallow the cubes. I felt like they could have a better life without me.
I finally concluded, after the trial and error of several medications, that I just wasn't going to get well, that I probably should check out. Look, I had a terrific job, terrific income, prestige, power, great friends, family, and here I am ready to, check out.
They see themselves as so unbearable that they actually begin to believe that by killing themselves, they'll be doing their family and friends a favor.
I ended up in pretty bad shape, and they put me in the hospital. And that was the beginning of me getting treatment.
When treatment finally comes, the answers are hardly easy. Access to care is often limited, even for the insured. And medications many times require a difficult course of trial and error before the right treatment balance is achieved.
If you have hypertension, you can easily see a physician anytime. But if patient has depression, then there are a lot of restrictions on how many times you can see the physician or the healthcare provider, and how long can you do that.
Unfortunately, our healthcare system is organized in a way that makes it very hard for primary care doctors to spend sufficient time with patients to diagnose and treat depression. So we need someone who can take the time to help the patient through those early weeks of maybe even increased discomfort until we get to the other side of the mountain where the beneficial effects of treatment are.
The first person you interact with after you've decided to get some help for your depression is that person ought to send a message of hope, ought to say, listen, people recover from depression every day. And your expectation should be, we're going to work together, we're going to identify your strengths, we're going to give you skills to manage this, we're going to work on getting you the best medication possible, and you can expect to have a meaningful life.
Many have found a key to recovery in peer support. In peer support programs, people who've suffered from depression are trained to help others, often with great results and at lesser cost than many traditional mental health services.
When I was referred to a support group, I was very hesitant to go to one. But when I did go there, I realized that this was a welcoming atmosphere, and was for the first time that I was with a group of people that shared the illness that I had.
First of all, a peer has walked in your shoes. They probably understand the hopelessness. They probably understand the sense of, this life's not worth living. And they've also are examples that they have come through that and have developed skills to manage their illness and to direct their own recovery. Bottom line, it's not only is it cost effective, it works. The preliminary data looking at Medicaid recipients indicated that they improved in 3 areas when they were getting peer support. There was symptom reduction, there was an increase in functionality, and there was an increase in natural supports in the community. And at half the cost of some of our traditional services.
There's a reason that 4 million people contact DBSA every year. They contact us because information is power. The more information that they have, the greater the possibility that they're going to get well.
Depression, a real illness, and a treatable illness, one people can live with, like diabetes or heart disease, provided they receive the right diagnosis, treatment, and support. Yet challenges remain to improve access to and the quality of care, to eliminate stigma, and to reduce the cost of this illness to our society. People with depression can and do get better. It is up to us, our duty, to make sure that proper treatment and support are available to those who need it.
Depression doesn't care what you look like. Depression doesn't care what a person does for a living. Depression doesn't care where you grew up.
We really need a major reorganization of our healthcare system so that people who suffer from mental illnesses have equal access to treatment and are equally likely to be reimbursed for getting that treatment.
The good news is there's a wide array of interventions that are very effective, that can mitigate and stop the progression of depression and return people to their normal functioning.
If you don't believe we can recover, then your funding and your services reflect that belief. If you believe recovery is possible, everything changes.
It is possible to have recovery and to live in recovery. I'm only one of millions of people who live in recovery all over the world.
It reminds me in a way of people sort of going into great turbulence or something in an aircraft, and you're there with them and you just stay with them until you get to blue skies again. I know for most people we can get to blue skies. We can.